So the Assembly of Pediatrics consists of a number of different disciplines focused on improving child lung health. These disciplines include pediatric pulmonology, neonatology, pediatric critical care, as well as nurses, respiratory therapists, and researchers who are involved in specifically studying child lung health. We focus on advocacy issues as well as research and training our next generation of pediatric physician scientists. Those are really important missions for the Pediatric Assembly. We are also very focused on trying to spread across the world and work with our international colleagues in improving diagnosis of rare lung disease, as well as developing guidelines for a number of different pediatric lung diseases with our international colleagues. And that is a big focus of the Assembly as well. I would say that there have been several recent developments in our field that have made a significant difference in children with lung disease. One of those is in the area of cystic fibrosis. We are able to identify these children earlier. In addition, the therapies have significantly improved. The CFTR modulators have made significant differences in overall lung function, weight, and just overall improved prognosis in children and adults with cystic fibrosis. There has really been a paradigm shift in this specific population. In addition, I think that we've gotten better at identifying rare lung disease in children, including areas such as primary cilia dyskinesia, where we're identifying children with this specific rare lung disease. In the past, these children would not have been identified as having primary cilia dyskinesia. Other improvements have been in the area of asthma, where we're seeing also improved therapeutics in this population as well. And finally, I think that other recent developments have included more international collaboration that have been leading to international clinical trials in rare lung disease such as cystic fibrosis and primary cilia dyskinesia. Because of the personalized medicine approach in these patients, it's important to do this in an international way, and that has definitely progressed rapidly over the last several years. So the activities that are of great interest to our Assembly include Pediatric Year in Review, which is always very well attended. In addition, we have an early morning series where you can get maintenance of certification that is standing room only. It starts at 7 a.m. And that is a very popular session as well. Another thing that has become really popular has been the way we're doing our poster discussion sessions now, which is in a rapid, what they call a rapid way, where the presenters present their poster in a minute and a half. You then go around and look at the posters, and then that's followed by a poster discussion. And I think that has really improved those sessions, and that has become much more popular as well. Other things at the conference that I think are important for Assembly members are that we have a number of different committees that our members can attend, as well as our Founders Dinner, which occurred last night and was very well attended, where we really give awards to people that have made significant differences in our field.